Hello and welcome to the next episode of the Explain series. I'm your host, Dr. Brett Palmer. In the Explain series we take one subject in sexual health and explain it. And this week it's barrier methods. So that's condoms, femidoms and dental dams. So this is going to be a bit more of a fun episode. And so what are condoms? Well, condoms are a form of barrier method. So are dental dams and so are femidoms. And the good thing about a barrier method is that they prevent sexually transmitted infections, or they're very good at preventing. So there's lots of stuff on the internet which say that condoms don't work or they're a waste of time. The truth is, condoms, and there are many different colours, and they come in different shapes and sizes, which we'll see in a moment, they're not 100% effective. So if you use them absolutely perfect, they can be 98% effective, but we're human beings, we are not perfect, and so that brings our effectivity around to 85%. In terms of using condoms to stop you getting pregnant, I would say birth control stops you getting pregnant, condoms saves your life by stopping you getting infectious diseases. Okay, so as a general mantra to go by. You can have condoms. Well, there's loads of different manufacturers. So that one's called Manzi. This is a French one. Passante, Durex, Skin. These ones are latex, and this one's non-latex. So there's all different types you can have. So how do you open up a condom? You don't use scissors, and you don't open up with your teeth either. Okay, so the way you open it up is quite simply, they've got serrated edges on either side, and near enough all condom manufacturers have. And the reason why they are serrated because they're easier to just rip open and use. And you take it out, and what you have is a little hat. Okay. Now if you turn it the wrong way around, okay, you won't be able to push it down at all. Okay, but if you have it on here, it looks like a little hat. And here we have the obligatory banana. This is obviously representing a penis or a toy. And so how do you put it on? Well, if it's a penis, you can put, now if it's a latex condom, for all condoms, you can only use water-based lubricants or silicone-based lubricants, okay? Don't use anything else. So if your friend turns around and says, oh, just use Vaseline or cooking oil or butter, don't use any of that at all. Especially don't use things like toothpaste as well, which some people have been using. That's really, really painful. The fluoride will really make things sting down below. So only water-based lubricants or silicone-based lubricants. Now if you're putting it onto a real penis, not a toy or a banana, then you can put a tiny bit in here, because that will make the sensations on the head of the penis a little bit better. And then you just push the air out of the penis with two of your fingers and put it on the end, and then just roll it down. Okay? Very, very, very simple and not difficult. Now you can put more lubrication on the outside, and then do what you're going to do, and then once you've finished, before the willy goes soft, pull the penis out, and then either you or the partner needs to hold the condom and then carefully take it off, making sure that the fluid stays at the tip of the base of the condom, and then the contents don't spill out everywhere. Okay, and then you'll have the fluid at the bottom. You then tie a knot in it and you throw it in the bin. Okay, you put a bit of tissue paper around it if you want and throw it in the bin. Do not, whatever you do, flush it down the toilet. That's quite weird, because that I think was a flavoured one, and that was a strawberry flavoured one, and it was a strawberry flavoured one. Yeah, it was a strawberry flavoured one. Weird. Right, on to other types. So here is a non latex one, and you might think, oh hang on a minute, it looks like a latex condom. Yeah, well, they can look the same, condoms tend to look the same, and it's the same general principle, and as you can see with a bit of experience, you can whip condoms off and on. So when should you change condoms? Every now and then? Well, if you're using a sex toy, if there's more than one partner in the room, if you're in that lucky situation, then obviously, and you're using a sex toy or your penis, and you're going from partner to partner, you should change to a new condom with every new partner. You put the toy or the penis in, and that's very, very important. If you're with the same partner, these are condoms are single shot use. Don't reuse the condom. It's very important. Other things with condoms are, here is a gold condom, or a nice yellow one. This one is banana flavour. Weirdly enough, a banana condom, a banana flavour condom on a banana, and it's really quite strong scent. Oh, that's not very nice. You can also have, if you're having a lot of anal sex, then what you can do is use what's called an extra thick condom, where the rubber is a little bit thicker. Now, some people don't like it because they think it's not very nice because it's too thick and they lose sensations. But with anal sex, it's advisable to use a slightly thicker type of material, and it goes on exactly the same way. Okay, right, so that's condoms. Obviously, and with all condoms, take them off carefully and wrap them in a piece of paper and put them in the bin. So that's the male condom, very easy to use, and the more you use it, the easier it gets. As you can see, I could quite easily open the packet and put it on within seconds. Not much really of a passion killer in my opinion. So the female condom, so I've just started to open this, I've just opened the packet, and so this is a female condom, also known as the femidom. You're thinking, Christ, how the hell do you put something like this in? Well, there's two rings. There's a bigger ring and then there's a smaller ring. And you need to find the smaller ring, and then you bend the smaller ring, and then you pop that into the vagina, and then just push it to the base. And then the woman who's putting in the femidom holds the ring while the man puts his penis in. Now, if you don't hold the ring, what happens is, okay, that one's going in fine, but what can happen is if the penis catches the edge, you can take the whole condom in, and after a few in and out actions, what's happening is the penis can go on the outside of the femidom, which obviously is not going to work, because when the man ejaculates, the sperm will then go around to the cervix, and then impregnation can occur. So so starting again, so you put the ring, bend it into the vagina, hold on to the outside of the ring while the man puts the penis in, and there you go, that's it. And they're obviously very, very stretchy, like condoms. Do your business, and then once the man takes his penis out of the condom, you twist the femidom around, and then you pull the femidom out. And again, that goes in the bin, not down the toilet, because you'll stuff the toilet up. So, last but not least, you have dental dams. And so we have two flavours of dental dam. One is blueberry, and the other is chocolate. I'm surprised they don't have a Nutella flavoured one. So what do you use dental dams for? Well, it's exactly the same as condoms really. It's to stop disease spreading from one person to another. And so you can use them for cunnilingus. That's where an individual licks around a vagina. You can also use it for rimming. That's where an individual licks the rectum, or the backside of another individual. And so all you do is my hands are getting a bit slippery now, open one up and pull it out, and it is, weirdly enough, in a condom shaped packet. And there you go. It's very, very easy to use. You just rip it open and then you unroll it and then you place it wherever you need to lick, to put it bluntly. And so if you have the vagina there or your rectum there, you put it over that area and you can hold it straight and then go to town with, you could go with your finger or you could go with your tongue, like so. And that is a chocolate flavoured one. Probably, do you really want to use a chocolate one for rimming? I don't know. I don't think it sounds like a good idea. They're very, very stretchy, like condoms. So when people turn around to you and say, well, condoms, oh, they break, they're not very strong, I don't really fit into it. That's very, very strong and it hasn't broken yet. Very, very strong. Yeah, I can see how when people are at college and university, they can put them over their head. See, I don't know any, I've never seen any man that big, and so it easily fits over any size individual. So, that's barrier methods. So you've got the condom, the femidom, and the dental dam. You can get them at your local sexual health clinic. You can also order them online. There are many, many different types of makes. If a make is not recommended by various individuals, then don't use it. Buy a load, have fun. They only work when you take them out of their packet, so use them, have fun, make it part of sex, and have a happy, healthy sex life. Take care. Bye-bye.